My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. All right, this is Dr. Tushar Mehta. I'm back again talking this time about diabetes on behalf of Hina Modi and plantshift.com. All right, so let's talk a little bit about diabetes. Diabetes is a worldwide epidemic, okay? Just gonna take some USA stats right now, and we can sort of extrapolate those principles or those problems to the rest of the world. In the United States, there's 29 million people who have diabetes, so it's about 10% of the population or 9% of the population. And if you look at the population over 20, it's 37% either have diabetes or pre-diabetes, so it's a huge amount of people. When you go over 65, it's about 50% of the people have either pre-diabetes or diabetes, the combination of that. So this is specifically, again, type 2 diabetes that we're talking about. So that is a lot of people. In Canada, the percentages of the population, the numbers will be different, but similar percentage population, we're going to have these problems. And same in other parts of the world, India, Europe, South America, Mexico, whatever. People are getting huge amounts of diabetes all over the world. Why does this matter? Because it has various terrible complications. There are people who have heart attacks, strokes as a result of diabetes, okay? Kidney disease, renal failure. People who have peripheral vascular disease, so bad blood vessel disease in their limbs and resulting in diabetic foot infections, amputations in some cases. So there's a lot of suffering and a lot of death attributable to diabetes. That's premature death, that's what we're talking about. And we'd like to prevent that as much as we can. You can take all kinds of medications, you can take shots of insulin, but it's not such a nice way to live, all right? So what is the evidence about plant-based diet and diabetes? Let's talk about one study here, published in Diabetes Care 2009, 60,000 subjects in the Adventist 2 group of studies. Now this is early on in the Adventist group of studies, so these people were followed for only about 4 years, I believe, and they had vegetarians, vegans, people who were fish eaters, semi-vegetarians, and meat eaters. And again, with the Adventist group of studies, the people who were eating meat were eating less than half the meat of the standard population. So again, there's already a group of people eating less than usual meat, so kind of healthier than usual. So do you still find a difference between that and somebody who's not eating any meat? Okay. What they found in this study was that the vegans had the lowest body mass index, so that means that they were the closest to sort of what a body, the slimness, the level of fatness that a person should have, okay? So about, and then the next was the vegetarians, and semi-vegetarians, and fish-eating people, and then standard diet. So there's this contrast, there's this progressive becoming more and more overweight as people had more and more animal products in their diet. And the same thing happened with diabetes, okay? There was only, the people who were vegan had pretty much 49% less diabetes than those who were meat eaters. Those who were lacto-vegetarian had close to, maybe 45% less diabetes. And the semi-vegetarians, fish-eating people had, 25-30% less diabetes compared to those having closer to a standard American diet, all right? So progressive plant-based diet, progressive lessening of diabetes. Great study, and there's other studies in the downloads that you can get to that sort of support that, showing similar results, okay? So that's really good. Now, interestingly, those studies were also adjusted for age, gender, ethnicity, education, income, physical activity, even television watching, sleep habits, alcohol use, and body mass index was all controlled for. So they did really control for the other factors, as they do in the Adventist studies, and so it was a very good quality study, you could say. All right. Now, some European data. From the EPIC European Prospective Investigation into Cancer trial, looking at over 12,000 incidents of diabetes, following people for 12 years. So they have a very large group of people looking at sort of, it's maybe about 50,000 people, and they're watching these group of people for over 12 years and looking at the diabetic cases. And they found that people having the diets with similar energy amounts, so people eating this type of diet or this type of diet, but overall getting the same amount of calories, for every additional 10 grams of animal protein per day, women had a 19% increase of diabetes. Sorry, there was about a 5% increase of diabetes, but if a woman was obese, if it was obese women, they had a 19% increase in diabetes, okay? And there was no increased diabetes if the people were consuming plant-based protein. So plant-based protein was safe to have in higher quantities, but animal-based protein was associated with more diabetes, all right? Let's look at a couple of other things. Here's another study, long-chain omega-3 fatty acid, fish intake, and the risk of diabetes in the risk of type 2 diabetes mellitus. American Journal of Clinical Nutrition, 2009. So this is an interesting study, okay? I'll tell you why in a sec. 190,000 people, so that's a huge number of people, followed for 14 to 18 years, so a very robust study. And they were sort of interviewed at 4-year intervals about their diet. Over 3 million person years, over 9,000 new cases of diabetes, huge studies. And what they did was, in this group, they didn't have a vegetarian subgroup. It's not like the Inventus studies. Now, the good thing about the Inventus studies and the Epic Oxford study is that, yes, they do have a vegan subgroup that you can look at. But the fish group, the people eating fish, might only be eating a tiny amount of fish. So it's really hard to tell what is the effect of fish. They're pretty much almost vegan anyways in many cases. So are you really having a benefit because you're eating fish? Or are you having a benefit because you're pretty much almost vegan? It's hard to tell. This study that I'm talking about now didn't have a vegan subgroup. There's no vegan subgroup, but what they did was they had incremental amounts of people eating fish, and they divided people into 5 groups, those having hardly any fish, maybe a little bit, to the next group, the next group, and the next group, and then the highest group of people having fish 5 times or more per week. So they're having a significant amount of fish, okay? That's a good comparison group. Those having, hardly any, maybe once a month or something, to those having it 5 times a week. They found that there was 22% increased diabetes in the people having the most amount of fish, okay? Here's another study that's also very interesting. 2009 diabetes care, egg consumption and risk of type 2 diabetes in men and women. Now, when it comes to eggs, it's very interesting. The egg industry publishes some of its own studies. It supports, funds, and publishes its own studies. And guess what? They all make eggs look good. They also take data from other studies like the Nurses' Health Study and Physicians' Health Study. They take that data, they manipulate it, and they do certain things. They take the study, they exclude diabetes. They exclude certain high-risk people, and then just study some of the people for a shorter amount of time, and guess what? They come up with the idea that, oh, eggs don't cause any harm. But if you look at the original studies that they're extrapolating data from, and just take all the data, you find certain things. So here's the study I mentioned from 2009, another one from the American Journal of Clinical Nutrition, egg consumption in relation to cardiovascular disease and mortality, the Physicians' Health Study. So both of them taking data from the Physicians' Health Study. They found that there's about 56,000 people in one group and 20,000 in the other, and they're comparing people who had less than 1 egg per week to those who had 7 per week or more. And they followed them for 20 years. What they found was that those having the most eggs, so comparing those who had more than 7 eggs per week compared to less than 1 egg per week, there was a 58% increase in risk of getting new onset diabetes for those who consumed the most eggs, all right? Now, there was a 12-year, so it was 20-year follow-up for men, 12-year follow-up for women. They found that there was a 77% increase for new diabetes in the women who consumed the most eggs. There was 23% increased death from all causes in those who had the high amount of eggs versus the low amount of eggs, and a 2.1% increased death in diabetics who had the low versus the high amount of eggs. So if you're diabetic, it's particularly deadly to consume a lot of eggs because you have double the chance of death, okay? When you're followed over, 12 to 20 years for these men and women. So incredible impact. Now, just be careful. When you look at the studies, look if they're funded by the Egg Marketing Board or the Egg Board and stuff like that. And same for other things like milk and whatnot. If it's done by a university, that's one thing. But if it's data taken by these things, by these organizations, and then put out in their own study, or a study just done by themselves, okay, there's a lot of data manipulation going on. Okay, so look at a study that's done by a university, not funded by those by industry. Okay. Here's another one. High intakes of protein and processed meat associated with increased incidence of type 2 diabetes. In the British Journal of Nutrition 2013, finding that a high protein, low carb diet, whereas many diets are like that, the Zone diet, Paleo diet, Atkins diet, same diets pretty much, all just repackaged and rebranded and given to people to follow. People do lose weight on these high protein, low carb diets, but what happens also is that they get other problems, okay? They find that there was basically more diabetes in the people in the high protein, low carb diet, okay? Okay, other studies on obesity. Again, people having more of a plant-based diet, less obesity. On average, you can still find a vegan who's fat. I know people who are plant-based, vegan, and they're fat. But on average, if you take all the average of these weights, they are lower and more closer to like a normal body mass index as compared to people who have progressively more amounts of animal protein, animal fat. So the references for every single video that I have are going to be downloadable from the description box, where you can click and download the entire set of references and then just scroll down to the relevant references. If it's a video on diabetes or cancer or something like that, scroll down to the relevant section and take a look at the references that I'm speaking about. In my videos, I'll generally discuss one reference, but it's going to take too long to discuss 10 references and you'll be bored out of your mind. So I'll discuss one and then you can go into the reference list and look at more references that are talking about the same topic. And it's important not just to have one reference, but to have multiple references that discuss a topic, because then you're seeing that different studies are being done in different places by different people and they're getting similar results that are reinforcing each other. Okay, so that's another good thing to look at.